Hello and welcome. In this clinical deep dive, we're going to get up close and personal with the HemoSphere Monitor from Edwards Lifesciences. This is a platform that's really designed to give you a complete, fully integrated picture of your patient's hemodynamics. Hello, anesthesiologists. Commuting to and from work in this cold weather must be very challenging. Please take care and avoid catching a cold. Bonjour, chers médecins anesthésistes. Les trajets quotidiens par ce temps froid doivent être éprouvants. Prenez bien soin de vous et évitez d'attraper un rhume. Namaskar, माननीय anesthesiologist डॉक्टरों. इस ठंडे मौसम में काम पर आना जाना वास्तव में काफी कठिन होगा. कृपया अपना ध्यान रखें और सर्दी से बचें. With that, let's jump right into this incredibly powerful technology. So here's our roadmap for this explainer. We're going to cover 4 main areas. First, we'll explore what makes the HemoSphere a whole new paradigm in monitoring. Then we'll get our hands dirty, so to speak, with the practical side of systems setup. After that, we'll dive into what is truly the game-changing feature, the predictive power of the Hypertension Prediction Index, or HPI. And to wrap it all up, we'll look at the solid clinical evidence that backs all of this up. All right, let's kick things off with our first section, a new monitoring paradigm. And this is a really important concept. We're talking about a major shift in how we think, moving away from just reacting to changes as they happen and towards proactively seeing them coming. So what exactly is the HemoSphere Advanced Monitor? Well, at its heart, it's a modular, all-in-one platform. Now, what does that mean? It means it's built to bring in data from a whole range of different sensors and put it all in one place, giving you this single, complete, real-time picture of your patient's hemodynamics. But, and this is the critical part, it doesn't just tell you what's happening right now. It's designed to look ahead and actually predict future instability. Now, this slide, this really gets to the core strength of the platform. You know, in our world, every patient and every procedure is different. You've got this whole spectrum of risk, and the HemoSphere is built to match that spectrum. For your incredibly complex cardiac cases or patients in shock, you can integrate the gold standard invasive data from a Swan-Ganz catheter. For major non-cardiac surgery, you can use less invasive data from an arterial line. And for moderate risk procedures, you can even go completely non-invasive with the ClearSight finger cuff. The real magic here is that HemoSphere unifies all 3 of these levels into one single, cohesive, easy-to-read system. To really appreciate what's new here, let's take a quick look back at a system we're all familiar with, the Vigilance monitor with the FloTrac sensor. Look, the Vigilance was a workhorse, right? It gave us our current CO, SV, SVV. It did its job well. But fundamentally, it was a single-function device. HemoSphere, on the other hand, is a totally different beast. It's an advanced modular platform designed from the very beginning to pull in data from many different sensors and, this is the key, to layer powerful predictive algorithms right on top of all that data. And this table really lays out that evolution in black and white. You see, where Vigilance relied on uncalibrated pulse contour analysis, HemoSphere is a true multimodal platform. But the biggest difference maker is right there in the second row, predictive analytics. HPI simply did not exist on the older system. This creates a huge difference in decision support. Vigilance just shows you the numbers. HemoSphere gives you advanced guidance through that HPI secondary screen we'll talk about. And just look at sensor integration. Vigilance was locked into the FloTrac. HemoSphere throws the doors wide open to Swan-Ganz, Acumen IQ, ClearSight, and more, all displayed on one unified screen. Now let's do another quick comparison, this time with the Vigilance monitor that we used with the Swan-Ganz. Again, Vigilance was great at its one specific job, continuous CO and SVO2 monitoring. HemoSphere does that exact same thing, but it does it as just one part of a much bigger, more comprehensive platform. The user interface has jumped from old-school buttons to a modern, intuitive touchscreen. The expandability is night and day thanks to those modular slots. And, of course, HemoSphere brings advanced software like HPI and modern connectivity to the table, things the Vigilance just wasn't built for. Okay, so let's just boil it all down. What are the key advantages of this new way of thinking? First, it's integration. You get the full spectrum of monitoring in one box. Second, it's about proactive insights. You're not just looking in the rearview mirror anymore, you're predicting what's coming down the road with HPI. Third, it's decision support. It helps you understand the why behind the numbers. Fourth, expandability. This is a future-proof design that can grow as technology does. And finally, a modern UI that makes all this complex data so much easier to understand at a glance. Okay, so that's the theory and the philosophy behind it, but how does it actually work when you wheel it into the OR? Let's move on to our second section, systems setup and integration. We're going to get practical and look at the actual hardware and software. So here you're looking at the side panel of the HemoSphere monitor, and this is really the nerve center of its versatility. You can see those multiple expansion slots right there. This is the modular design we've been talking about. This is what lets you completely customize the monitor for exactly what your patient and your procedure need on any given day. And the great news is the setup process is incredibly intuitive. First, you just slide in whichever hardware modules you need for the case, say the Swan-Ganz module. You power it on, pop in the patient's height and weight. Then you connect your sensor, the Swan-Ganz, the arterial line, whatever it is, to its dedicated module. The monitor then prompts you to pick the right mode, and finally, it'll walk you through any zeroing or calibration steps that are needed. It's really that straightforward. And let's just quickly run through some of the key modules you'll be working with. You've got the Swan-Ganz module for your most comprehensive invasive data. Then there's the pressure cable, which is what you'll use to connect to an arterial line sensor like the Acumen IQ to get that less invasive monitoring and, crucially, to enable HPI. You also have the oximetry cable for your continuous SVO2 and even a tissue oximetry module to integrate data on regional tissue oxygenation. In this slide just gives you a great visual of that modular concept in action. On the left, you see the robust Swan-Ganz module, ready for your sickest patients. And on the right, the much simpler pressure cable for your less invasive cases. You just pick the tool that's clinically appropriate for the job, plug it in, and you're ready to go. All right, now we're getting to the feature that, frankly, sets the HemoSphere platform in a class of its own. Let's get into our third section, the predictive power of HPI. This is all about that huge paradigm shift we talked about, treating hypotension before it even happens. I want to start this section with a question, and I really want you to think about it for a second. What if you could see a hypotensive event coming minutes before the patient's blood pressure actually starts to tank? What would that change for you, for your patient? This is the exact clinical problem that HPI was designed from the ground up to solve. So what is this hypotension prediction index? Well, HPI is a proprietary algorithm that was developed using machine learning on a massive database of over 130 million cardiac cycles. What it does is continuously analyze very subtle features within the arterial waveform, things that are totally invisible to the naked eye, and it crunches all that data down into a single, easy-to-understand number from 0 to 100. And that number represents the likelihood that your patient is trending towards a hypotensive event, which is very specifically defined as a MAP less than 65 for more than a minute. So when that HPI number crosses a certain threshold, usually it's set to 85, this is what you see on the screen. An alert pops up. But this is so much more than just another alarm going off. Think of it as a specific, intelligent call to action. It's the monitor tapping you on the shoulder and saying, hey, the patient's trajectory is changing. It's time to investigate why before the blood pressure actually falls. This alert is designed to trigger a beautifully simple and powerful clinical workflow. Alert, access, act. The monitor gives you the alert with that high HPI number. Your job is to then access the secondary HPI screen, which is designed to help you figure out the root cause. And then, based on that information, you can act with a targeted intervention that's based on the patient's actual physiology. And this is that critical secondary screen. This is really where the magic happens. The HPI number told you that a problem is probably on its way. This screen is designed to help you understand why. It breaks down the patient's current hemodynamic state into the 3 fundamental pillars we manage every single day: preload, afterload, and contractility. And it gives you a specific dynamic parameter to assess each one. So let's break these down, one by one. The indicator for preload is stroke volume variation, or SVV. Now, we all know SVV measures how much the stroke volume changes during the respiratory cycle in a patient on a ventilator. A high SVV suggests that the patient is on that steep, responsive part of their Frank-Starling curve. It's a good sign that a fluid bolus will likely increase their cardiac output. On the flip side, a low SVV suggests they're on the flat part of the curve, where more fluid probably won't help and could even cause harm. Okay, next up is the indicator for afterload, dynamic arterial elastance, or EA-DYNE. This one might be a little less familiar, but it is incredibly useful. It's calculated as the ratio of pulse pressure variation to stroke volume variation. So what does it tell you? A high EA-DYNE suggests that the patient's blood pressure is very sensitive to changes in their vascular tone. In other words, they are very likely to have a positive response to a vasopressor. A low EA-DYNE, however, suggests that vascular tone isn't the main problem and a pressor might not be your most effective move. And that brings us to our third pillar, contractility, which is indicated by dp/dt. This parameter reflects the maximum rate of pressure change during systolic ejection, and it serves as a great surrogate for the actual contractile force of the heart muscle. So if you get an HPI alert and you see a low dp/dt, it points you directly towards an issue with cardiac contractility, which suggests that an inotrope might be the right call. So this table is where it all comes together. This is your clinical roadmap. If your HPI alarm goes off and you see that SVV is high, the problem is likely preload. The potential intervention, a fluid bolus. But what if HPI is high and SVV is low? Well, then you look at the other two pillars. If EDD-dyne is high, it's pointing to an afterload issue, so you'd consider a vasopressor. And if both SVV is low and dp/dt is also low, the root cause is probably a contractility problem, guiding you towards an inotrope. It's an incredibly logical, targeted, and physiology-based approach to treatment. Okay, a powerful algorithm and a logical workflow are fantastic, but as clinicians, we need to know, does it actually work in the real world? So for our final section, let's dive into the clinical evidence and see how HPI holds up when put to the test. The first study we'll look at focuses on a particularly high-risk group of patients, those having major abdominal aortic surgery. As you know, these are cases where you don't just anticipate hemodynamic instability, you pretty much expect it. The objective here was very straightforward. Could using an HPI-guided protocol actually reduce the amount of intraoperative hypotension? It was a randomized controlled trial. One group got standard reactive care, and the other group was managed using that HPI workflow we just discussed. And the key finding was absolutely compelling. The group managed with HPI guidance had significantly less hypotension. Not just fewer minutes of it, but the events themselves were less severe. The study's conclusion really says it all. The authors wrote that using this predictive algorithm led to a notable decrease in hypotensive events, and they go on to say that this suggests that making that shift from reactive to proactive management isn't just a nice idea. It's actually possible, and it is clinically beneficial for our patients. Now, let's pivot to a completely different clinical scenario: cesarean sections under spinal anesthesia. This is a really important study because it tests HPI's performance using the totally non-invasive ClearSight finger cuff in a patient population famous for having rapid and significant hypotension after a spinal. So the goal here was to see if HPI still worked well when it was getting its data non-invasively. They monitored women having C-sections with the ClearSight cuff after they got their spinal anesthetic. And the key finding was that even without an arterial line, the HPI algorithm showed strong predictive performance. It was still able to give a reliable early warning that hypotension was coming, which gives the clinician that precious time to intervene before the pressure drops. So, when you put these two studies together, what are the big takeaways? First, HPI has been validated across very different clinical settings, which shows how robust it is. Second, this is tangible proof that the paradigm shift from reaction to prevention has real, measurable benefits. And third, HPI empowers us to practice true, data-driven precision medicine. It lets us get away from a one-size-fits-all approach and instead deliver interventions that are targeted to the specific physiological problem for that specific patient at that specific moment. So to wrap everything up, the HemoSphere platform really represents a fundamental change in how we can approach patient care. It transforms our hemodynamic monitor from being just a rear-view mirror that only tells us where we've been into a predictive dashboard that shows us where we're going, empowering us to be truly proactive. And that really leaves us with one final important question to think about. With the ability to see the future of your patient's hemodynamics, even if it's just by a few minutes, how will you change your practice? Thank you so much for your time.